Yes, that's exactly what I'm saying. And here's why. So I was the picture of health. And what I mean by that is I wasn't overweight. I exercised lifting really heavy shit 4 to 5 times a week. My BMI was in check. And not that I put a lot of emphasis on BMI, but some people still do. So my BMI was in check. I ate a really good, solid, clean diet. And I cycled outdoors over 100 miles a week. Then I walk into my practitioner's office to get my hormone levels checked. And she said, Cameron, this is you're at the age where we probably need to be thinking about doing some advanced level cardiac labs. I said, yeah, let's do it. Of course, I wanted to know what's going on before I get the call or have some sort of event. And guess what? My labs come back and I'm in the danger zone. And what do I mean by danger zone? Well, you have no risk or low risk, then you have normal, and then you have you're creeping up there. You have a moderate to high risk. And then I was above that. I was literally in the red, in the danger zone. And you're asking, well, and I asked myself that too. I'm like, how is that even possible? I ate right. I exercised like way more than most people. Never a day in my life been overweight. My stress was probably moderate, like everyone else's. That certainly can't be it because I'd been stressed more than that in my lifetime. So, and even less encouraging was my well, so I thought less encouraging at the time. My cholesterol was in check. My HDL, my LDL, my triglycerides, my calculated ratio, all of that was in check. And I'm like, what the heck? How is this even possible? And she said, well, you've seen it. You've picked up people who've had no prior history, and then they have a sudden cardiac event. And by picked up people, I mean on the ambulance or, in the helicopter when I was flying. And I've also treated patients in the ER that have, again, had a sudden cardiac event with no prior history, and their cholesterol levels were within normal limits. So how is that possible? Well, we were not checking the right biomarkers. And by biomarkers, I mean the labs. And triglycerides and cholesterol ratio is not a good predictor. Again, research. Cholesterol is not a good predictor of cardiovascular disease. We need to be more focused on APO levels, ApoB levels, apolipoprotein B. What is that? That essentially is the end all be all, at least of the latest research, of the predictor of cardiovascular disease. There's a study done at UC Santa Barbara just a few years ago that checked cholesterol levels of every patient that came through the door with the chief complaint of a cardiac event, chest pain, myocardial infarction, which is a heart attack. And all of their levels our cholesterol levels were normal. So why were they having these cardiac events and going undetected? It's because their practitioner did not look at the right biomarkers. And if you are at all concerned with health span, lifespan, longevity, anything to do with that, you must get your ApoB levels checked. Because if they are high, above 80, I think milligrams per deciliter is the unit of measure, but let's just say 80. If they're above 80, that needs to come down. Anything above 80 is not good. Mine was, I'm even embarrassed to tell you, but in the triple digits, in the not so low triple digits. And these things can be easily corrected, addressed with simple lifestyle and behavior modifications. And if you say, well, I don't want to do that, well, you can certainly go on prescription drugs. But to me, that is sort of cheating the system. And what I mean by that is studies have shown that for every intervention you're doing to reduce your cardiovascular risk. That in turn affects neurodegenerative status, i.e. dementia, Alzheimer's, equally, if not more, than it addresses cardiovascular risk. So what does that mean? You're getting 2 for 1. You're getting a BOGO. If you're exercising and you're eating right and you're changing your lifestyle and behavior, and I'm not talking about a complete overhaul, but just things to make your heart better and more healthy, those interventions will spill over to your neurodegenerative status. So everything will improve, meaning you've increased your lifespan and your health span. I mean, the evidence is there. This is, again, it's not just me saying that this is what you need to do because, I read something on Joe's website. No, that's not the case at all. The studies are there. And I did it. I know it works. I lowered my ApoB levels. And again, it takes a little bit longer with behavior and lifestyle modifications than it does prescription. But with behavior and lifestyle modifications, there's no side effects. But there are side effects with prescription medication. And this is not medical advice, and I'm not advising you to do one way or the other. I'm simply stating that you have options and you need to determine what the best option is for you. And I can tell you this, if your ApoB levels are really, really high, you may want to consider prescription intervention because it is a little bit quicker. And if you are obese or you have other comorbidities, other illnesses and disease, and you have other contributing risk factors, such as you smoke, you don't exercise, you have a really crappy diet, you may want to consider prescription intervention. And I'll finish up your question with this statement. If you want to get your ApoB levels evaluated and you go to your practitioner and they say, that's not important, your cholesterol's fine, you're good, come see me in a year, get a new practitioner. Because that lack of knowledge for current day, not only measuring cardiovascular risk and status, but lack of concern for your own health should not be taken lightly and certainly should not be dismissed. And I would go so far as to say, if they do not honor your request, find a new practitioner, because you're going to be fighting tooth and nail to get any prescriptions that you need, should you need them. And by the way, ApoB levels are not expensive, regardless of what they tell you. I checked yesterday for a walk-in to Ulta Labs, ULTA, they're all over the country. An ApoB level was $35. That may vary from region to region, I don't know, but anybody can afford $35. Anybody. And if you haven't had your yearly labs done, just tell your practitioner that you want to add on a cardiac IQ panel. I as in indigo, Q as in queen, cardiac IQ panel. And that will include everything you need to know. And again, if you can't get the IQ panel done, at the very least, get an ApoB level done. All right, next question.